All right, in this next section, we're going to turn to talking some more about healthcare system and policy. And so, first, just take a moment. I know you're listening to this later, sitting at home, but just take a minute to just reflect on. You can do one or both of these, whichever you prefer. Think about a time when you had a positive experience seeking medical care, or you can think about a time you had a negative experience seeking medical care, right? And what about your experience made it good or bad, and what did the provider do or not do? This could be, a doctor, a nurse practitioner, the person at the front desk. What made this experience good or bad? What aspects of the experience besides the person may be added to the positive or negative nature of that experience? Was there something about the wait time, the examination room, the check-in procedures, the bill you got at the end? What made for a positive or negative experience here? So you can just think about that for a moment on your own. And if we were in the before times in an in-person, in-class environment, we would discuss this as a group. And one of the interesting themes that has emerged over time is that I've taught this course now in the U.S. before and in Canada, and certainly people have negative healthcare experiences in both places. But the nature of these is very different, whereas most of the experiences raised by students in the U.S. had to do with concerns about cost and access. Here in Canada, we do certainly still have concerns, but they were much more about issues like wait times and the experiences with the doctors themselves, as opposed to their ability to access care or to pay for care. And so we'll see these themes emerging in some of the points we talk about in these next few slides. So first, again, I'm an American, and so I used to teach this in the U.S., and we would spend, a whole lecture talking about all the reasons why, essentially, it sucks that we do not have universal health care in the U.S. Most people, if they are insured through their job. It's difficult to even get a job that gives you insurance. It has to be a full-time job. Insurance through your job is not always that great. And so, certainly I want to start with talking about some of the reasons why healthcare in the U.S. sucks, but then I also want to turn to talking about some of the specific things that Canada can still do to improve. I think it's a disservice to you that your neighbor to the south is so bad on this topic because that's your most relevant comparison group. And as we'll see when you compare to other countries, Canada isn't doing as well as it could be in terms of healthcare. And so I'll be showing that in some data over the next few slides. So first, no surprise, I think, to anyone here, the U.S. spends the most on healthcare. Here, it certainly would look even more dramatic if we looked at just the numbers, but what we're showing in this graph is the percentage of the gross domestic product, right? So the wealth of the country, how much of that is spent on healthcare, what percentage, and looking at this over time. And so back in the 80s, that wasn't, the U.S. was still at the top, but it wasn't quite such a outstanding in terms of how much more money it was spending than other countries, but we can see over time that has increased dramatically and at a much faster rate than spending has increased in comparable countries, and such that the U.S. is spending about 16 or 17% of its gross domestic product on healthcare, whereas Canada is only spending about 10%, Australia 9%, right? It's really, the U.S. is separating from the pack here in terms of how much money it's spending on healthcare. And while many Americans would like to believe this is because we're getting that best health care, research doesn't really bear that out, and so we'll be seeing that. Also, before I get into that, one important point, right, is it's not just that we pay more out of pocket, right? We understand Americans, most of us, a lot of people do not have health insurance, and even if they do, they still have to pay for a lot of procedures out of pocket, and certainly that's true. We do pay more out of pocket. This is the private spending on healthcare, is shown in blue, right? So you can see Canada here. There's a amount of private spending. Not everything's covered. Often dental care is not covered for people, certain medications. But in the U.S., we are spending significantly more than other countries of private spending, but we're also spending just as much or more publicly, right? Our tax dollars are also going to healthcare. We seem to forget that as a country, but we are spending quite a lot of tax dollars on healthcare, but we're also paying out of pocket. We're paying money that we're not being taxed on, so not tax dollars, money that's coming directly out of people's pockets is also going to healthcare in the U.S. So we're spending more in both categories. We're also spending more on like every area of health costs, right? So what we're looking at here is what percentage of the budget is going to these different aspects of healthcare cost, right? There's the public health and administration part of healthcare. This is all of the paperwork that goes into that, figuring out if insurance is going to cover certain procedures, making sure that billing is working, that the bills go to the right people, that care is coordinated in that way. And so really all of the paperwork and administrative aspects of the healthcare system, you can see that, well, that's the smallest portion overall. This is one of many areas in which the U.S. is spending significantly more than other countries with comparable levels of economic development, right? So we're paying 296% more in this category. It's about 3 times as much. And a lot of this can be attributed to the fact that we don't have universal health care. And so with all these different health insurance companies trying to figure out whether they will or won't cover a medication or a procedure, there's just a lot more paperwork involved in all aspects of the healthcare system. And that costs money. It costs money every time you process a form and have to pay somebody to sign this thing or fill out this paperwork or do that. And so there's a lot of money that essentially is wasted at that level. We also see more spending in all of the other categories, more spending on pharmaceuticals and medical goods. Prescription drugs cost more in the U.S. Compared to most other countries. Spend more on what we call ambulatory healthcare. This is all the outpatient visits, things that you don't go to the hospital for or don't stay over in the hospital for, but going to visit your doctor, the dentist, a same-day visit, minor surgeries where you leave right afterward, diagnostic imaging. We overspend on all of those things for a number of reasons, both because it just costs more for these things in the U.S. We've set the prices higher. We allow companies to set their prices without as much government oversight to keep those down and to keep them affordable. We also just provide more care. Sometimes that's not needed. So a lot more diagnostic imaging. People are much more likely to be sent for an MRI for more minor things than they would be in other countries. So there's just a lot more spending on this type of care as well. So a lot more payment for care that may or may not have value. There's also more spending in hospitals and nursing homes as well. And for similar reasons, doing more care than may be necessary at times, but then also because it costs more to do all of these things, right? We've set the prices higher. We allow medical companies to charge more for their equipment, for pharmaceutical companies to charge more for their medications, for anesthesia, for everything. And so you can just see the comparisons here with Switzerland, Canada, Germany, France, and Japan paying much more reasonable amounts for this. Right, so we're overspending in every area in the U.S. But we don't live any longer, right? It's not like this is, because we're getting the best care and it's really working. We can look at ranking this data from the World Health Organization in 2015, who lives the longest by countries. So Japan has the greatest life expectancy for both men and women. We can find Canada and the U.S. on here. So the U.S. is only 31st on this list. Despite thinking we're number 1, we're actually number 31 in terms of living a long time. So life expectancy on average is 79.3 years. For women, it's 81.5. For men, it's 76.9. But on other lists, we drop to 43rd, depending on exactly who's doing the ranking and which data they're using. So definitely not number 1. Whereas Canada on this list is number 12. The life expectancy average of 82.2 years, right? So that's a significant difference. That's a whole 2 more years that you get as a Canadian. That's not exactly how stats work, but on average, Canadians are living 2 years longer than Americans. Women are living to 84.1 and men to 80.2, right? So these are significant differences here. And you can just see some rankings of other countries here as well, right? So certainly we're not number 1, we're not living longer, and our overall healthcare ranking in terms of looking at the efficiency, the equity, indicators of actual health among the population, the U.S. comes out at the bottom in comparison to its similarly developed countries. And so we can see here we are at the very bottom, but Canada here is not doing much better. And so this is looking at some overall rankings of healthcare quality, but I want to delve more into these in the following slides and what exactly they're ranking these countries on and where Canada falls on particular sub-factors within this overall healthcare ranking. So again, you can see here the U.S. is coming out at the bottom, but we're an unfortunate comparison group as the worst of the developed nations in terms of healthcare and health. And the overall process of healthcare and equity and efficiency in that, we're not a great comparison point, right? Certainly Canada is doing better, but then if you look at other countries that against which it might also compare, then it's not doing so well anymore. And so I want to unpack that a bit more in these coming slides. And so here we're just looking at the healthcare performance scores, the same type of scores on the last slide, but just looking, you can just spread them out a little bit. This is the average across all 11 of these countries, and so you can see the countries that come out in terms of higher performance, they're above average, and those that are below average of this 11 countries and their healthcare quality. You can see that Canada is also below average, right? The U.S. is certainly the lowest performing. Next they have France here and then Canada, but it's the top performing ones here are the UK, Australia, and the Netherlands, right? So you can see that it's not doing as well in comparison to those. We can graph this slightly differently and just add to this graph looking at how much spending is going on as well, right? So here we just have the performance, but now let's graph the performance against the spending. And here again we can see just how much the U.S. sucks, right? So all these other countries are spending a more similar amount, right? So spending sort of a moderate amount on healthcare, but there's variation in their performance, right? The U.K. is spending about the same as Canada, but their healthcare performance of their system is much higher, whereas the U.S. is spending more and sucking more. So you can see that very clearly here. Again, breaking down this overall ranking, right? So in this overall ranking, it's coming out as 9 out of 11, right? So the U.S. is the worst here, France next, and then we've got Canada coming out as 9th overall. But what goes into this overall ranking? So it actually consists of a few different things, and I'll go more into these as we keep talking on this slide. And so the first is care process, which Canada comes out 6th. It comes out 10th on access, really quite low. 6th on administrative efficiency, right? So these are the rankings relative to other countries. 9th on equity, so pretty low down, and 9th on healthcare outcomes, right? Doing pretty poorly there as well. So just again, breaking these down a bit more, what is care process? This really refers to are people getting high quality care? Is that care safe? Are they? What's the number of medical malpractice suits that are occurring in a given country? Is that care coordinated? Are doctors communicating well with one another? Are people, getting sent to specialists when they need to be sent to specialists from their general practitioner? Are those two physicians communicating well with each other in terms of coordinating that patient's care? Are patients' preferences and engagement part of this process, right? Are patients included in their process? Do they feel like they have autonomy and a say in their healthcare process, right? So this is Canada's doing, middle of the pack on that. Access is quite low. This has to do with affordability and timeliness, and so certainly doing better than the U.S., right? Most people have a basic healthcare package. If you're a resident in Canada, you have access to that, but it doesn't cover a lot of things. It doesn't cover dental care. It may not cover eye care. It may not cover some of your prescription medications. And so this is where we see this lack of affordability and access there. There's also a lot of differences in ability to access care depending on where in Canada you are located. Here in Ontario, in a major city, in Toronto, there's hospitals, excellent hospitals all around, specialists. But when you get into some of the more rural areas of Canada, you may not be able to access that care. You may need to be helicoptered to some place. You may need to drive a really long way. You may not, even if you could afford it, may not have access to that care. And so this is part of that estimate here being quite low. Another concern is timeliness, right? One of the main concerns among Canadians is the wait times for care that they might receive. And so certainly this is a concern, and wait times can be quite long for procedures that are not life and death, right? So this often the stereotype coming from the US is that, Canadians wait for treatment until they die and they never get it. There's very little evidence to support that. There is evidence that, for less life and death procedures, things that can be delayed, things like a cataract surgery, things like that, people do wait longer for that in Canada than they do in the US and in some other countries, but more people ultimately have access to that care. This is going to be something that Dr. Martin, in the video you'll watch, talks a lot about and makes some really excellent points around. Right, so certainly the access is a place in which Canada could greatly improve. There's also a severe lack of access and for First Nations peoples, and not having access to quality healthcare is a major concern there. Canada also scores relatively low on equity, right? And this really relates to, the way that they calculate equity is comparing the health outcomes and this performance of the healthcare system for the highest income individuals and for the lowest income individuals. And again, certainly the US is worse because the highest income do have healthcare and the lowest don't have any at all. Whereas in Canada, some of the lowest income people may still have basic healthcare, but there's still quite a discrepancy in terms of the type of care people have covered and their access to high quality care based on their income level. And so this is still a major concern in a place where Canada doesn't do as well as some of these other nations. Also overall, just on healthcare outcomes, right? There's still not as healthy as some of these other nations that we're looking at here. And there's a lot of different factors that play into that. Certainly the healthcare system is part of that, but there's also all kinds of other factors related to diet, lifestyle, things like that come into play. I think you can see that really clearly when we look at the UK here, right? So they have the number one overall ranking in their healthcare system in terms of, right, they have a great care process, very equitable access, equity is number one, administrative efficiency is quite high, but their healthcare outcomes are 10. The only less healthy country is the US. So here we can really see some of that influence of diet and lifestyle factors. The diet and lifestyle of the UK is, similar to the US in some ways, right? You call them you call them crisps, we call them chips, we call them French fries, you call them chips, but we're all eating a lot of that kind of food and having a more sedentary lifestyle. And so you can have a great healthcare system, but if people are not otherwise healthy, you're still going to see these negative healthcare outcomes. But you can imagine how much worse these might be were there less of an excellent healthcare system within the UK. So we can see this again here. So here's again is where Canada falls, doing better on care process and administrative efficiency relative to the other things categories here. And one of the big pieces of administrative efficiency here and why Canada does so well is its nationalized healthcare system. That does make things much more efficient. But again, as Dr. Martin will talk about, there are ways that care could be even more efficient and administrative systems could work better. And so she'll talk about some of her big ideas around that in the film you watch. So that's the next thing here is, so you'll want to watch this video interview with Dr. Danielle Martin. She's kind of one of my healthcare heroes and a really important researcher, physician, and dominant force within Ontario in trying to shift the way that we think about healthcare and to further improve these systems. And she really sees physicians as needing to play a key role in that. A lot of times she argues that physicians may feel like their hands are tied around certain things because of policy, but who's better positioned to try to change that policy but physicians? And so she is a physician herself, but also an advocate and a what's the right word? A lobbyist for changing healthcare policy. And so one of the really just fascinating things that she opens this talk with, and I just want to make a point here about this as well, when we think about differences between the US and Canada in terms of the healthcare system, really the starkest difference that's borne out, and I've really seen this in the way that students talk about healthcare and the way that professionals talk about it, is that In Canada, people really seem to view healthcare as a right, that's something that everyone deserves to have access to basic healthcare, to have their medical needs met. Whereas in the U.S., we really see this as a privilege, something that needs to be earned, right? We see healthcare as being attached to having a job or having parents who have a job. And you get better healthcare if you have a better job, right? It's really, again, seen as a privilege. You have to earn that in some way. And so this is part of why a lot of the arguments for universal healthcare within the U.S. are not even heard in the same way as they would be heard here, right? We're starting on with a different assumption about whether this even is a right or a privilege. And so when you think of it as a privilege, people start to feel competitive around that. Well, I worked hard to get my health care. You shouldn't just be given that, right? So you get that kind of resistance there, whereas Canadians really do see this as a right that you don't need to earn. You get that by being a human. We should care about your health, and you should have access to care, right? And certainly we can continue to improve that care, but the two countries really have a different underlying philosophy about how we think about the right to care. And so you're going to watch her talk about these big ideas, but I just wanted to put them on a slide to help organize that as you're listening. Right? So she talks about really 6 big ideas for improving their healthcare system in Canada. She talks about improving relationships between the person themselves and their physician, so the patient and physician, but also relationships between physicians and improving coordination of care and communication among doctors. She talks about having a national pharmacare plan, right? That it makes no sense that we cover, your treatment in the hospital. You go in and you get treatment for some type of disease, but then you need to take a follow-up medication. And we don't cover that, right? We cover your outpatient procedure, but we don't cover the medication that comes afterward. And that makes no sense at all, right? In fact, pharmacare is an important part of medical care. It goes right alongside procedures that you might be getting. And if people don't have access to the medicine that they need and can't take their medicine, then they're likely to need more invasive care later because they're not able to, do these preventative care pieces, take medication regularly that might prevent, increases in blood pressure that lead to a heart attack, right? We cover care for the heart attack, but we don't cover that blood pressure medication. And so she talks about really the need for a national pharmacare plan so that we're covering medications for people. We're going to talk more about this in the next section of this lecture, but in some cases, less care, right? That often, this is something that the U.S. suffers from as well, where we're over-testing people, doing more diagnostic tests than necessary in some cases, doing more surgeries than may be necessary in some cases. And so she talks about, how we might want to be considering doing less care in some cases. Also talks about reorganizing resources, right? That some of the biggest concerns within Canada are wait times and access to care. And she argues that it's not that we don't have the resources to provide this care. Often the wait times come from, having too many people waiting to see one specialist when there are other specialists who have openings, but no one is aware of that. And so she talks about how we can reorganize our resources so that we can actually improve the system without actually needing more. We may not need more money in the system. We may need to just reorganize the way that system works. This has been a controversial one, but one of my favorite ideas of hers, which is the guaranteed annual income. And this has been tested out in a few places now, but there's pretty strong evidence to show that if you give people a basic income, you give them money, their health will improve. That having enough money to take care of your basic needs is one of the number one things we can do to improve the health of our nation. And so she makes a strong argument for guaranteed annual income. And then she also talks about, this is related to the reorganizing resources as well as the improving relationships point of really increasing collaboration and not competition among providers, right? So there might be really established providers who just don't have time to see everybody who wants to get into their office, and they could refer some of their patients to upcoming new doctors who are trying to fill their brand new practices, who've just come out of med school, and they're perfectly qualified, right? They just don't have the word of mouth or the rep yet to have people lined up to get into their practice, right? So there could be more collaboration to share those resources. She talks about how we're often referring people to a specialist who doesn't have time. Why not just be able to, call up that specialist and ask them questions about the patients that you have, so that the patient doesn't even need to go see that specialist directly, but they can consult on cases. And this can be a really efficient way to get more access to high quality care for people. So really increasing this collaboration rather than competition. She also talks about that there really are these pockets of excellence around every area of medical care in Canada, right? There are different hospitals have specializations in different areas. In Toronto, we have one of the leading areas applying virtual reality to managing pain. And so we can collaborate and share all of the knowledge and lessons learned in these centers of excellence with other treatment centers and hospitals around the country. So rather than setting up competition for resources among hospitals, sharing and collaborating with what we've learned and applying that more broadly. So these are really the 6 big lessons that she talks about, and so definitely watch that video so you can hear it from the expert herself. All right, so I'm going to pause, I'm going to stop here, and then we'll pick up for the last section on the paradox of healthcare usage. And so this relates to Dr. Martin's, one of her points about, in some cases, maybe less healthcare is really what we need. And so I want to talk more about what this means. This seems very counterintuitive, and so I want to unpack that more in this last section. So see you then.